Okay, we're back on Clout 941. We're here with Dr. Julio Gonzalez, who's talking about his book, Healthcare Reform, The Truth. Doctor, if you had to identify the one single biggest problem with the healthcare system in the United States, what do you think it would be? If you had to pinpoint one thing.
I would think that increasingly there are external factors that are getting involved in our ability to take care of our patients. On the one hand, on the private sector, we have insurance companies that are increasingly regulating how we can take care of patients and what we can do for our patients, and it's not necessarily based on quality.
Can you explain that?
It's
what do you mean?
It's what they do is they give it different various names. They can call it quality reporting, or they can call it excellence lists. And essentially they are ways of trying to get physicians to be on preferred providers lists on the insurance company side. And so if you land on one of these preferred providers lists, then you get more patients because you get a little extra star by your name or whatnot. Well, the problem is that the way they rank us is based on cost efficiency to the insurance company. So it's not really about quality of care, it's not really about how good our outcomes are, it's not really about how much time we spend with our patients. It's about who's providing the cheapest care for the insurer. Similarly, the same thing is going on with Medicare and the government programs. They have patient quality reporting standards where they want us to put little checks in the box. But if you do a scientific survey of how we're performing, it really doesn't balance out with what Medicare and CMS, the Center for Medical Services, Medicare and Medicaid Services, the government agency that handles Medicare and Medicaid. It really doesn't go with quality. It doesn't correlate with quality. It correlates with cost efficiency and how willing we are to jump through their hoops to provide the care that they want us to. I think that's a huge threat.
The Bacchus plan that you criticize, is that similar to what Obama is talking about?
It's very similar. As a matter of fact, when I decided to write the book and I finished reading the Bacchus plan, I realized that this was lockstep in line with what all the leadership of the Democrat Party had in mind for the upcoming administration. It was completely in sync with the Obama's plan. It's in sync with, obviously, the Bacchus plan, and it's in sync with Pelosi's views.
What is this plan? What are the biggest changes or differences if it's enacted in total to the current system?
The single biggest change is this concept of a national insurance exchange, which is a system where all insurance providers are going to have to enroll if they really want to have access to a big patient population. And then what the government does, of course the government is enacting this exchange. And what the government does is then it will stipulate that there's only 3 types of insurance packages that you can give. And in the Pelosi bill, they call it the basic, premium, and premium plus. And you can only provide one of those 3. On the government side, it'll be very similar. And so what that does is essentially it straps both the government and the private payer into one single network that is pretty much manipulated and guided by government regulation. So I think if the biggest change, the most significant change, it all proceeds from there. It's a national insurance exchange. There's all sorts of other exchanges that you've heard about, you might want to talk about today, you know, including the public option and all these things that you hear about. But the bottom line is, whether the government owns the health care or not, they are going to direct it, and they're going to say how it is employed and how it is delivered to the people.
Now, if Senator Bacchus was sitting here, I mean, I suppose his argument would be that this type of a system accomplishes 2 things. It covers more people, and I guess the costs are somewhat controlled. Is that basically the argument he would make?
Right, and it's interesting. There's 2 versions of what needs to be, what the problems are, and I didn't realize that there were two perceptions. The first perception is that from the government, 2.1 trillion costs too much money. 2.1 trillion dollars a year the United States is expending on this. There are 50 million folks who are uninsured. Essentially, that's their problem with it. And then the third one that Senator Baucus would tell you about is disparities. There are different groups that are getting different kinds of care than others. But if you talk to the common person who's out there who's really concerned about health care, they're only worried about three things, and they're kind of different. They're worried about the fact that they feel vulnerable. If they get real sick, they might lose all their life earnings. They're paying too much a year. About $6,000 out of their pocket is coming out a year. And the third thing that they're worried about is that they don't trust insurance companies. And there's certainly a valid sentiment. So based on that, they're willing to hand it all over to the government. And my point is that it's probably something that you want to take some time to review and see if that's really what you want to do, because you might just be biting into another poison apple.
Okay, it's time to take our last break. When we come back, we'll have our final segment with Dr. Julio Gonzalez and our Weasels of the Week.